This is a case summary containing severe calcification. A 63-year-old male was admitted to the hospital due to unstable angina. His only coronary risk factor was dyslipidemia. The coronary angiogram shows an intermediate stenosis in the obtuse marginal branch. The left circumflex provides collateral flow to the right coronary artery. The IVUS pullback begins in the distal segment of the obtuse marginal branch and ends in the proximal segment. There are 360 degrees of severe superficial calcium within the lesion. Multiple repeating white layers can be seen beyond the calcium. These are highlighted in the still IVUS image and represent the reverberations from the superficial calcium. Reverberations can be caused by calcified plaque, especially after rotational atherectomy or occasional stent struts. Calcium is an intense reflector of ultrasound that then bounces back and forth between the calcium and the transducer, each time causing a reverberation. Although not sensitive, reverberations are highly specific for calcium or metal. This is a summary of the IVUS findings, showing still frames of the obtuse marginal from proximal on the left to distal on the right. Panel C shows the minimum lumen area, measured as 1.6 square millimeters. Panel D shows the distal part of the lesion with the reverberations that we noted previously. Circumferential calcified plaque is seen throughout the lesion. We will now repeat the IVUS pullback. Maximum balloon size was 3.5 millimeters in diameter, and the maximum inflation pressure was 20 atmosphere. The IVUS pullback starts in the stent. The stent looks underexpanded by IVUS, even though the angiographic result was good. Note that the reverberations shown by blue lines are still present, and that it can be difficult to differentiate the metallic stent struts shown as red dots from the calcium to which the struts are opposed. This is a comparison of the minimum lumen area pre-PCI and the minimum stent area post-stent. The minimum stent area was measured as 4.7 square millimeters. We will now repeat the IVUS pullback. Compared to IVUS, study data showed the sensitivity of calcium detection by angiography is reported as 48%. With a specificity of 89%. IVUS can also determine the location, arc, and length of calcium. However, ultrasound does not penetrate into the calcium. Therefore, IVUS cannot determine the thickness or the area or the volume of calcium. The apparent thickness on the IVUS image is determined primarily by the intensity of the reflected ultrasound.